Hello, it's Dr. YouTube here, where I upload educational videos on a regular basis. Today's episode will be all about hyperkalemia, high potassium in less than 5 minutes. We'll start with two scenarios and we'll proceed with the management and identifying hyperkalemia. So, two cases resulting in deaths. An end-stage renal failure patient with CKD stage 5, admitted to renal ward. As a night doctor, you were handed over, or your colleague was handed over to chase bloods from the day team. Unfortunately, this was not chased, resulting in an unfortunate death of a patient. Next case, patient with lymphoma, has chemotherapy, and unfortunately develops a cardiac arrest. Let's see why. So what is the definition of hyperkalemia? Anything above 5.5 millimole per liter is defined as hyperkalemia. Severe, in the severe spectrum, it's greater than 6.5. It is a medical emergency. It can be identified on an ECG with peak T waves, broad QRS, bradycardia. It can also present with ventricular tachycardia, sine wave, flattened P waves. As a medical emergency, it's more of the acute rise in potassium that is of concern, rather than, if a patient had been hyperkalemia for a period of time, any acute increase is not as severe compared to a normal potassium rising to a severely elevated potassium. So, what is the sequence of hyperkalemia on an ECG? As I said, usually you get tall tinted T waves to begin with. Eventually, you get broad QRS, flattening P waves. Finally, you get sine waves, ventricular fibrillation, and as you can see here, asystole. So, in the United Kingdom, and I'm sure in many other countries and continents, hyperkalemia is a patient safety alert. As a patient safety critical point to identify. In the UK, it's considered time critical, as in many countries, and there are unfortunate failures or lapse in managing this, unfortunately. For example, here you've got abstracts, real reports that, saying that the day team could deal with a high potassium, or that treatment of hyperkalemia was prescribed, but it wasn't followed up for various reasons. So all in all, this identifies the importance of identifying hyperkalemia and prompt management. So what is the prompt management? Well, here's one mnemonic which I hope may help with you in memorizing this. It comes to medical and nursing exams. C, big K drop 2 and 6. What does C stand for? C is the most important thing. You want to stabilize the cardiac membrane, giving calcium gluconate. 10 mils of 10% over 10 minutes. It has no effect on serum potassium, but it does have effect on the heart. Prevents VTVF. You want to give salbutamol 10 or 20 milligrams stat. So that activates a sodium-potassium pump to get potassium into the cells rather than out in the blood. Sodium bicarb may be beneficial in some cases, especially if the patient is acidotic. Insulin and glucose. You can give 5 to 10 units of Actrapid in 100 mils of 20% dextrose over 30 minutes. Calcium resonium is occasionally used, and more importantly, especially in your dialysis patients, or if they're not peeing at all, or if, in spite your calcium gluconate, your salbutamol, insulin glucose, after 2 rounds of those and still not improving, then really you should be thinking about dialysis in these patients. Speak to your intensive care colleagues and renal team. In long term, occasionally a low potassium diet may be beneficial, so speak to your dietitian. It's important to repeat your renal bloods, your potassium in particular, 2 hours after intervention. And also because you're giving insulin and glucose, it's important to monitor blood glucose hourly for the first 6 hours. But the main point here is C, big K drop 2 and 6. So calcium gluconate, beta-agonist, salbutamol, insulin, glucose, K is for calcium resonium, D is for dialysis, low potassium diet, D diet, and 2 hours repeat use and ease, and glucose every hour for the first 6 hours. C, big K drop 2 and 6. This will save a patient's life. So these are my references, and I hope you found this presentation helpful. If you do, give it a thumbs up, subscribe, and share. Take care, and look after your kidneys. Take care. Goodbye. Dr. YouTube signing off.